Okay, wonderful. Thank you all so much for coming tonight. We are so glad to see you and to be with you. I'm Megan Neubauer. I am the Executive Director of the Michigan Ovarian Cancer Alliance. And I'm so happy for the opportunity to be joined here by Dr. Roy. Dr. Roy has agreed to give a presentation and share a little bit more about food labels, especially with the holidays coming up. I know I always have questions about as we're looking and making decisions about what we're eating and what we're putting in to foods. It's always so helpful to have a little bit more information as we're going into this busy season. So Dr. Roy is with the Associate of Integrative Medicine, and we are so glad to have you here. I'll let you share a little bit more about yourself and your background and hand it over to you for the presentation.
Thanks, Megan. Okay, so this was supposed to be Dr. Mensa, not Dr. Roy. Dr. Roy was supposed to be in the background. And I, unfortunately, am not a nutrition expert, so I don't know everything there is to know about food labels, but I know enough to be useful and enough not to be dangerous. So I will be giving you as much as I can, and I'll probably start actually, and I'm going to, if you don't make me a host, Megan, I won't be able to mute everybody, but if you do, I can. And if you mute yourself, thank you. I am going to be using the chat sometimes to talk to you guys. I may also post things in the chat like a Jot forum, which will allow you to ask questions of the practice. You can ask me questions as I'm talking through the chat. If you really want to, you can unmute yourself and ask me questions, although we will, as Megan said, try to leave a little time at the end for a Q&A for people who can't be bothered to use the chat function or who are trying to watch this through their phone. As Megan said, I am a guest today for Mioka, and I am Dr. Roy. I'm a natural medicine doctor. For those of you who are patients of mine, you've heard me say this many, many times. I'm a fancy kind of doctor, which means I have both the training in natural therapies and nutrition and in conventional medicine for cancer care. So I'm what's called an integrative oncologist or a naturopathic oncologist. And that means that my job is to bridge between cancer care and natural medicine and nutrition so that I can help you to find the most safe, evidence-based, and effective strategies to fight cancer naturally and fight cancer using both the best worlds. Some of you I see on this list here are not ovarian cancer patients. Because this is a Mioka hosted talk, I'm going to talk a little bit about ovarian, but I will try to answer everybody's questions. So again, use the chat. Let's make this as interactive as possible. I know some of you are cooking dinner and watching this at the same time. So I want to start with what is a cancer fighting diet? So I think one of the things in terms of talking about food labels, and I'm going to be using a whiteboard, I'm going to be sharing my screen, I'll be doing lots of things to be able to teach today. But one of the things when we're talking about food labels is we're really talking about processed food. So there's whole foods and then there's processed foods. And when foods are processed, that's when they have a label attached. So a whole food doesn't have a label attached to it, a processed food does. Why is that? It's because a whole food comes from the earth or from the natural world, right? So fruits, vegetables, nuts, seeds, fish, we're not going to see labels attached to those. But processed foods are foods that have to be manufactured, altered, or in some way prepared in order for them to be consumed. And so processed foods are processed, and we really shouldn't, instead of calling them processed foods, because everything is really processed, right? The question is, are they a food? Are they a whole food, or are they a food product? So when we're talking about a cancer fighting diet, there's really only 3 basic rules, although there is emerging data with specific diets in ovarian, which I'll touch on later. The 3 main rules for a cancer-fighting diet are to eat less, to eat whole foods, right? And to make half your plate fruits and vegetables. So if we're all doing this, basically this, we're doing the best that we can. Eating less means just using smaller plates, like using dessert type plates instead of dinner plates, making sure half your plate is fruits and vegetables. So we're used to treating a fruit or a vegetable as a side dish. So if this is your plate, and I'm dividing it in 4, we're used to this being your broccoli and this being your mac and cheese, for example, and you would just switch it so that this would be your broccoli, and the rest of it would be the side dish, would be your mac and cheese. So these are very, very simple techniques. It sounds so basic. It sounds like you don't need to hear from a doctor to learn these things. But very frankly, if we were all doing this, we would be 90% of the way there for optimizing nutrition. Eating whole foods is where I want to kind of focus when we're talking about food labels, because when we're talking about food labels, we're not talking about whole foods. So if we're talking about food labels, we're already breaking one of the rules for a cancer-fighting diet. So let's talk a little bit about food labels. Good. Let's talk a little bit about food labels. So food labels look somewhat like this. You guys are all familiar with them. I'm going to share my screen again. I have so many things up. I'm hoping that whatever I show you guys is going to be clear and not fuzzy and certainly not patient data. So this is a food label. Most of you have seen these before. All I did was just Google image of a food label. And let's just go through it briefly. So this food, whatever it is, has 6 servings in the container of food. So let's assume it's a box. And let's pretend it's a box of macaroni and cheese, since we were talking about macaroni and cheese. So in that box, there are 6 servings for that particular food product. And each serving size is 1 cup. So that means that there's 6 cups of that food product. So all the information on this food label is actually, I'm hoping everybody can see me. Yep. So all the information on that food label that we are looking at is related to just that serving. So just the serving size of 1 cup. So in 1 cup of this food product, there's 250 calories. So if I'm eating 3 cups, I'm getting 750 calories, right? And then all of this information here is relevant to that cup as well. So there's 12 grams of fat, for example, 210 milligrams of sodium, for example, 5 grams of normal sugar, meaning sugar that occurs naturally in this food product in this cup. Also at the bottom of these labels, below these nutrition facts, you usually see an ingredients list. And I'm just going to Google here ingredients list on a label so we can just see what an ingredient list looks like for a sweet cookie. That just came up naturally. I didn't even plan on that. For those of you that are just joining, if you could turn off your video. We're recording just so we can keep you anonymous, even though I should be the only video pinned. So as you can see here, these are the ingredients of this sweet cookie. I'm not going to even embarrass this website by opening it up and seeing where is this sweet cookie made. But I do want to point out a couple things, and that is, what are the first ingredients in this label? The first ingredients are the most the things that are most volume in that product. So in other words, to make this sweet cookie, we needed most of all sugar. So if we needed 10 things, or I'm saying if we needed 100 grams of something, we needed 90 grams of sugar. So if the first ingredient is water, that means the product is mostly water. If the first ingredient is sugar, that means the product is mostly sugar. So the second most common or concentrated ingredient in this sweet cookie is flour, and the third is white flour. In general, when you're looking at ingredients, if you're really trying to be careful and use food labels to your benefit to fight cancer or stay well in survivorship, you don't want sugar to be in the first 3 ingredients unless it's a dessert, like a sweet cookie. So if you were intending on eating a cookie, no big deal. Sugar should be in the first 3 ingredients. But if you were intending having a salad dressing, for example, and sugar is in the first 3 ingredients, then you're really having a dessert and not necessarily a salad dressing. Does that make sense to everybody? I say those things reflexively, realizing I'm just looking at myself. So I'm going to say, yes, it makes sense to me. Good. Moving on from that, I also want to point out to you guys the kinds of ingredients in here. So when you're looking at the ingredients on a label, another good rule to follow is, are there ingredients on here that you don't understand, meaning they're not in plain English? So for example, you may not understand colors titanium dioxide. Actually, do know what titanium dioxide is, but there could be things like butyl in here or methylcellulose or whatever. If it's something you can't pronounce and you don't know what it is, it's likely an additive or a preservative. Why would there be an additive or preservative in it? Because a food product, guys, is really intended to have a very long shelf life. It's not meant to be consumed right away. It's meant to sit on a shelf, which is why one of our cardinal rules when grocery shopping is to spend most of your time on the outside of the store and not on the inside, right? Because the outside tends to be whole foods and the inside tends to be processed foods where you're looking at labels. Now, we all have to rely on processed foods for some of our lives because processed foods, at least in this country, are efficient, right? That's why we buy them usually. And they also taste really good. But the problem with additives and preservatives that you can't pronounce is they're usually manufactured ingredients to make the product taste better and also make you eat a little bit more. So you want to watch out for ingredients that you don't know or can't pronounce. Now, I don't see anything in here that I really can't pronounce, but I will point out dyes. So usually food, especially if it's manufactured, can be almost a gray color. So if it's processed, it's going to have dyes in it or coloring in it. And dyes are known carcinogens, particularly red dyes. So this is a probably not a great cookie to have, even though it's a sweet cookie. Now, is this cookie going to kill you? No, it's not. If you want to have a cookie, you should have a cookie. My rule of thumb is to aim for healthier versions of the things that I crave, like a cookie, for example. The other thing I want to point out on these food labels are the no-nos. And again, I want to just remind everybody to type in their questions in the chat. And they can be general nutrition questions. They don't have to be specific to food labels. Again, this isn't my expertise here. I should have mentioned at the beginning, Dr. Mensah had the best of intentions of being here today, but he has a medical emergency and is unable to attend. So I'm here for you, and I can answer any questions about natural medicine and nutrition as they come up in your mind while we're talking, okay? So moving forward from here, some other rules to think about is what kinds of ingredients you should really, really avoid. Things that are just no-nos unless you're going through chemotherapy. So remember, for our patients, if you're going through chemotherapy, I really want you to eat what you crave, and I don't want you reading labels. Labels And understanding food products well is really for our patients in survivorship, not for our patients in treatment. So one of our no-nos, though, are high fructose corn syrup. Why? So high fructose corn syrup is a substitute for sugar. It is essentially a type of sugar, but it's highly processed and it has no nutrient value in it, and can change the way your body understands sugar. In fact, there's many, many kinds of sugars, and I'm just going to pop a list up here, and including things that you may not even know or think of as sugars. But if you're shopping at, let's say, a natural foods market, for example, you might see maybe things that are like rice syrup instead of high fructose corn syrup. Now you're seeing me look all over the place here because I have multiple screens up. I'm trying to watch the chat and also post things from my notes here for you guys. So these are just examples of types of sugars that you might see on a food label, high fructose corn syrup being one of them. So why do we use high fructose corn syrup? It is very cheap. It's industrially made. It tastes really good. And so it's financially beneficial to companies to use it. But in terms of our health being our wealth, and in terms of being sick as being the most expensive thing you can ever do, that's something that if you're in survivorship, I would really like for you to avoid. Okay, good. When we're thinking about sugars, there are ways to think about like healthier sugars versus not so healthy sugars, right? So again, if we're in survivorship and we're trying to qualify the kinds of sugars that we're eating, something that trends towards a whole food versus a food product or a processed food is going to be the one of the ways to tell the difference is the type of sugar in it. So for example, when we're thinking about whole sugars, honey is a good option. It comes from obviously processing by bees. Maple syrup is another good option. A less good option, but available to you, is stevia, which is from a plant. And then we can go down the list, agave, which is from a cactus. And we can keep going down this list as we go, molasses. So maple sugar or maple syrup, excuse me, is from a tree. Now, just because something tastes like honey doesn't mean it is honey, right? As we move forward in this world and there's changes in the environment, we are seeing less and less bees. So real honey has become more and more expensive. My best option for buying honey is to buy honey from a glass jar from a local market or from your farmer's market. Your local farmer's market or co-op should have a good high quality honey. Honeys that come in those teddy bear jars are usually not honey. Those are usually ultrafiltrates mixed with sugar and water. So you have to be really cautious of honey when you're buying it. Maple syrup, same thing. Something can taste like maple syrup and not necessarily be maple syrup. I hate to mention brands, but Aunt Jemima's, for example, may not be actual maple syrup. And we could even look at the food label of a maple syrup like that. Although I hope that when we do post this, I don't get in trouble for this. And I don't even know, right? I don't know if Aunt Jemima's actually is or is not healthy syrup because I don't drink that kind of thing. But we can look at it. So when we're thinking about sugars, aiming for whole food sugars is going to give us a better chance at our body using these things in a good way. And when we're thinking about sugar in general, or food labels in general, or food in general, what we need to be thinking about is food as fuel. So I don't like to get into this place. So here we go. Here's the ingredients list for Aunt Jemima. Nobody laugh. although I know you probably are laughing. So I wish I could have you guys on, but I want to preserve your anonymity, but I'd love to have people tell me. So what is the what is the biggest ingredient in this syrup? Maple syrup. It is corn syrup. The second would be high fructose corn syrup, and the third would be water. So Aunt Jemima's maple syrup meant to taste like maple syrup from a tree, but is really a highly manufactured sugar water that also contains some preservatives like sodium benzoate and sorbic acid and sodium hexametaphosphate, which I don't exactly know what that is, but I'm assuming it's a type of additive. When it says here natural and artificial flavors, that's a really interesting category also in ingredients lists. So natural flavors can mean from animal products, like for example, anal glands from a beaver are often used for flavoring in food products, and artificial flavors means manufactured flavors. So again, I know most of you are probably highly educated, but you do want to be very careful about food products and looking at the labels. Okay, so let's come back to one more thing that I'd like for you to avoid in your labels, and that is trans fat or partially hydrogenated fats. So when we're looking at these labels, and I'll go back to one of the labels we were looking at before, we'll look at this sweet cookie, for example. Oh no, we won't look at that. We'll look at an actual nutrition facts food label. And we'll look at the types of fats that are in it. So if I go to this food label here, as we recall, this food label has 250 calories per serving. It's interesting to note here that the calories from that fat are 10. So 10 of these 250 calories are from fat. And in general, that's actually good. You want to have these calories from fat be about 1/3 of the total calories. That keeps your fat down. But when we're looking at our fat, what's more important here is to avoid trans fat, of which this has none, and partially hydrogenated fats, which are manufactured fats. And I don't see those here. So there's a lot of types of fat, right? So when we're talking about fat, we're talking about a couple things. We're talking about healthy fats like fats that come from plants, seeds, nuts, and fish. So plant fat that comes from these are the healthiest kinds of fats, right? We need fat. Fat's an excellent source of energy. It burns for a long, long time. It keeps us going. And it's super concentrated as a fuel. So it's excellent, right? And then there's another kind of fat from animal products. So other than fish, animal products would be poultry and pigs and beef or cattle, turkey, for example, that's a poultry. Those kinds of fats would be called saturated fats, right? These would be called unsaturated fats or omega-3 fats, right? And then the third type of fat is actually a man-made fat. So that's what we're talking about here when we're talking about trans fats or partially hydrogenated fats. These are really important to avoid in survivorship. Again, I don't care what we're doing during treatment, but in survivorship, this is very helpful because these fats are not used efficiently by the body, and they contribute to inflammation and cell growth, which is something that we want to avoid when we're trying to fight cancer. Good. So those are sort of some cardinal rules. So just to review, look at the first 3 ingredients in your ingredients label. Make sure that sugar is not in those first 3 unless we're aiming for a dessert. Avoid trans fat or partially hydrogenated fats in the label. Avoid high fructose corn syrup. Then the last thing that I want to talk to you about in terms of the nutrient facts, and then I'll just go over basically, I'll go over sodium, and then we'll kind of open it up. And that is the fiber in food. So fiber is really, really important, right? The government recommends, and in general, we recommend, if you're in survivorship, that you consume 25 grams of fiber per day. 25 grams is a ton of fiber. And fiber comes from beans, grains, fruits, and vegetables, which of course are whole foods. Those are not foods that are going to have a food label on them. And because it's not necessary, right? We generally know that when we're eating a whole food, that we're eating something that has been designed or evolved or grown to have all of these beautiful things in it. That doesn't mean it doesn't have pesticides and herbicides, and we can talk about that too if people are interested. But a food to really be healthy for you should have at least 3 grams of, 3 grams of fiber per 100 calories. So if we're looking at the labels that we were just talking about, I'm going to share my screen again for that label. If we're looking at these labels that we were just talking about, you see here that this isn't a great one because it's not giving me the calories per serving. So let's find another one that would be more helpful in terms of understanding this piece. What would we ever do without Google, guys? Okay, so here we go. So this one that we were looking at in the beginning says that in 1 cup, there's 250 calories. And so that means we want to have, in terms of fiber, we want to have at least 10 to 10.5 grams of fiber in this product for it to be relatively healthy. And as you can see, there's only 7 grams of fiber in here. So it's not super healthy. If this was a box of brownies though, one way to make it healthy is to throw in some whole food fibers. So for example, some quick fixes for these food products is just to add a can of beans, black beans, or a can of beets. If it's a cake or a brownie or something like that, that will make it dense and moist, but you won't be able to taste them, and you'll radically increase the fiber content. Anytime you're eating sugar, you just want to bind it with fiber and protein to make sure it moves through the body slower. I mean, essentially, I don't want to have a morality about food here, right? Food is fuel. We need food in order to do all the things we're doing. As I'm moving my hands right now, I'm using food. As I'm talking to you right now and using this brain, I'm using food. Food is not the bad guy, right? And there is no such thing as a bad whole food. So bananas don't cause diabetes, rice doesn't cause cancer. That's not how the world works. I know that there's a lot of information on the internet right now that kind of demonizes food. For example, the whole phenomenon around, does sugar cause cancer? Or feed cancer, excuse me. Sugar feeds everything. So everything that you eat, whether it's a whether it's a protein or a fat or a carbohydrate, is going to break down to sugar. So if I eat a boiled egg, it's going to become sugar. I've said this to you guys before. If I eat a donut, it's going to become sugar. The question is, how fast does it break down, right? A boiled egg is going to take a longer time to break down because it's got fats and proteins in it, right? Whereas a donut is mostly carbohydrates, very easy to break down. the time that it takes to break a sugar down is important. The second thing is the quality of the sugar. As we just saw in that sweet cookie label, a donut has a ton of other things in it that are pro-inflammatory. Why is that a problem? Well, when we're talking about cancer and cancer cell growth, anything that causes inflammation in the body is going to upregulate cell growth, which drives cancer and carcinogenesis. So the quality of that food really matters, which is why aiming for high quality whole foods is part of a cancer fighting strategy. And that's really where your head needs to be, not on, is this bad, is this good? And if you're eating a donut, but 80% of the time or 90% of the time, 80-20 is what Dr. March used to like to say, 80% of the time you're aiming for whole foods, eating less at each serving, and eating mostly fruits and vegetables, then you're 90% of the way there, and you don't really need to worry about having that donut once a week or once every couple of days, or whatever it is that you feel like you need in survivorship, right? I want to just talk briefly about sodium. So we only need, and again, I know I keep saying this, but sometimes I feel like everybody gets lumped into the same thing when we're talking about cancer. Oh, whether you're going through chemotherapy, whether you're trying to slow progression, whether you're in survivorship, whether you just have genetic risk, everybody is treated the same, and that's a real big mistake. And even between two people who have ovarian cancer, two very different women, perhaps one is Black and older and one is white and younger, though the way that food interacts in that person and how we use that food as medicine is very, very different for various reasons. And we can, again, if you want to ask questions or pop them up in the chat, we can talk about why. But coming back to this label, we only need 500 milligrams of sodium a day, unless we're getting chemotherapy, in which case we need a lot more. But for the average person, we need 500 milligrams of sodium per day. So if you look at this nutrition label, out of the servings here, there's 6 servings here. So let's say I had just one little cup of it. I'm already getting almost half of my required needs for sodium in a day. So sodium is like the silent actor in all of these food products, because food products it's not the sugar really or the fat that's usually a problem, unless you're really shopping in the Hostess section. The problem is really the sodium in it. And just to notice here, these sugars, by the way, it says 5 grams of sugar includes 4 grams of added sugar. That means that 1 gram naturally occurs, as we just talked about, as it would in a whole food, and 4 grams were added for taste. For a gram, one of my colleagues gave me the translation today in terms of how much sugar is in a gram. So let me just pull that up. So 1 teaspoon of sugar is 4 grams. So in this case, each serving of this food, each cup, has about 1 teaspoon of sugar in it. Okay. So I hope that's very helpful in understanding all these things. I want to give you a resource here. It's called the Micro Institute. Micronutrient Institute, excuse me, and it's through Oregon State, Linus Pauling. Linus Pauling's Institute Micronutrient Information Center. I'm going to pop that up here. So this is a very important resource in terms of really understanding nutrition, and you can put almost anything in here and learn about it. Like, for example, if I went to vitamin K here, it tells me what the summary is on vitamin K, that it's a cofactor for glutamic acid, which you may not know what that means, but if you read through this, it'll really walk you through it. It tells you the function of vitamin K and how it works in the body. It explains how it works as a coagulation factor and what it does for bones. It explains what happens when you have a deficiency. It explains what you need as an adult, what you need as a baby. It goes through specific needs for types of cancer and other diseases. It tells you adequate intake based on your age. It tells you what you need for prevention of different diseases in terms of where the studies are. For example, a lot of our patients are at risk for osteoporosis because they've gone on estrogen withdrawal or estrogen blocking therapies. And vitamin K has been researched as a necessary component in a program for osteoporosis. It tells you what the studies are for that data. And if you click on the citation here, it'll take you directly to PubMed, which we're going to talk about in a minute. PubMed is where the government publishes all clinical data done anywhere in the world at any time on a specific drug or natural therapy. So it's a beautiful way to really understand nutrients. And then it goes over not just one disease, but any disease that has data, so cardiovascular disease, osteoarthritis, but it also goes over food sources, which is really excellent. Of course, it'll only talk about whole food sources, safety, drug interactions, and what their recommendations are. So I really love the Linus Pauling Institute through Oregon State, and I will put that in the chat right now as a resource for everybody, because I think it's super helpful. But I will also say that plans really need to be individualized. So anybody can follow the rules that I've given you right now and eat well. But when we're someone who's faced a cancer diagnosis, things have happened in our body because of exposure to drug treatment, exposure to prophylaxis treatment, exposure to radiation, exposure to surgery that have changed the way that our body, for example, even processes that food. And so it's really important that you're evaluated for that and given a nutrition plan that's tailored to your specific needs. I want to just pop back up on PubMed and then we'll open it up for questions. So I had mentioned to you just a couple seconds ago, PubMed. PubMed.gov is where the government publishes all clinical data done anywhere in the world at any time about anything. So let's just put in nutrition, which I was looking at this earlier today, nutrition and ovarian, because we're talking about ovarian with Mioka. Let's put it up there. And what you can see here is that there's actually a lot of data, 3,500 studies looking at nutrition in ovarian cancer. So oftentimes your oncology team will tell you, oh, it doesn't matter what you eat. That's true when you're going through treatment. It does 100% matter what you eat when you're trying to prevent, or you're in survivorship, or you're trying to slow progression, like you're getting treatment, maybe with a targeted therapy, or a novel second line like Lenvima, for example. It does matter what you eat. And when we're talking about looking at this data, you can filter on the left here for clinical trial, and that will pull up the data that's been researched in a clinical setting, in a hospital setting. And there's very large trials right now, which I love to see, because when I started out years and years ago, and I was meeting with the head of the head of gynecological oncology at Henry Ford at the time, who was Adnan Munkara. He's now the head of Henry Ford's entire hospital system. And we were talking about including natural medicine and integrative care in Henry Ford's system. I talked about nutrition as being really important for lowering risk of recurrence, and I didn't get the job because there wasn't data at the time. So it's really encouraging to see that data has started to bloom. And as you can see, this data is very current. It's from this year, and there are very large trials happening now looking at nutrition, even with first-line chemotherapy, and looking at perhaps survival and quality of life in terms of combining nutrition with chemotherapy. So we're taking advantage of this data. We extrapolate a bit. We do know, for example, that certain nutrition strategies are very effective in lowering risk of occurrence. Like, for example, vegetarians have a significantly lower risk of occurrence of ovarian cancer. So we extrapolate some of that data into our current survivorship population, as well as taking advantage of this new data. And then something that's very, very brand new that's also exciting with ovarian, and I know this wasn't really a nutrition talk, was food labels, but I think we've cashed out food labels. I think you all get what you need there, is this data on ketogenic diets. So ketogenic diets have a lot of data with breast cancer. However, as you can see here, as you can see here, there's now some data coming up with ovarian that ketogenic diets are helping with physical function, energy, and food cravings in randomized controlled trials with ovarian cancer patients. So that's really, really important. Now, to be sure, just because a ketogenic diet lowers central obesity, that means big tummies, and lowers serum insulin, which means the pickup trucks that pick up sugar and delivers it to your cells, does not mean that it fights cancer. In fact, just because you're fat doesn't mean you're not fit. And just because you're fit doesn't mean that you're healthy. So there is a lot of misinformation and misconception around weight or obesity and cancer care that someone just popped up with their dog or somebody. So there's a lot of misinformation and misunderstanding in the medical community about weight, where a lot of people associate obesity, doctors in particular. Doctors are the worst culprits. And by the way, we're all not fit. We're also fat. Doctors in particular perpetuate this myth, telling patients that if you lose weight, you'll have lower risk. That's not true. Weight itself is not causal for cancer. It's correlated because weight is usually correlated with certain lifestyle habits. For example, leaning towards food products rather than whole foods. So I think right there, I'd like to pause and let's open it up for these last 13 minutes or so and give people time to just unmute themselves, get on video, ask their questions. We're going to stop recording.